dark times had us praying for some brighter days. Wishing well, but I'm really hoping for a change. Yeah.
This is Changemakers. I'm Eric Alvarez, as always, joined by Ashley Holt. And Ashley, as always, we both are joined by another amazing changemaker. Who do we have today?
We are. This is someone you and I both enjoy having conversations with,
we do.
Dr. Aditi Nerurkar. She is a physician for Harvard Med, of course, a medical contributor, which I think that doesn't cover everything that she talks to us about. But we really want to dig in with you just about how women's health has changed in the last few years. And I think you can't talk about that without talking about Roe v. Wade and the Dobbs decision.
When the Supreme Court overturned Roe v. Wade in the summer of 2022, the world changed for a lot of people. By the end of June, more than half of the country's abortion trigger laws were in effect, closing the doors of thousands of abortion clinics and automatically banning abortions in the first and second trimester, especially if they weren't medically necessary.
Dr. Nerurkar, how has that changed your job and doctors who treat women?
So I think one of the most important things to recognize in terms of Women's History Month, and this being the month that we are celebrating women, is that this generation of women of childbearing age have less rights than their mothers, which is a historical precedent, something that we have never seen before. We're moving in the wrong direction. Every medical society has spoken out very vehemently against the Dobbs decision because it infringes upon basic human rights. Bodily autonomy and that sense of bodily autonomy for every person should be a right and not something that is decided on by lawmakers. It should be a private conversation between the woman and her physician.
Doctor, I can kind of sense the urgency in your voice and in your message that you have here. I'm curious, for practicing physicians that you've spoken to, your colleagues and your friends, have you noticed an increase in that? Not just delivering the accurate medical information, but talking about the importance of, perhaps now more than ever, of women being aware of their rights and the things that they need to know.
What we're seeing is that because 50% of training programs, so medical trainees do various programs for fellowships and residencies to become experts in their field and deliver clinical care, 50% of these training programs are in states that have some sort of ban or limited access to abortion. So this impact is not just for this current generation of physicians and patients, but future expertise and that brain trust that we rely on in American medical care. It also changes what we consider the standard of care. Ashley and I talked about this several months ago in a segment about how that there is a uniform standard of care anymore. There once was, in terms of what to do, and an algorithm that we follow in clinical care on how to take care of a patient. But if these laws and different rules are in different states, it does impact how medical care is delivered, which ultimately impacts patient outcomes, the worst of which is maternal death.
I can already hear my messages going off before I even ask this question, but I have to ask it because you're the most qualified person I know to answer it. How has this changed how other parts of women's health are impacted? I mean, emotionally and mentally, because I think we can all say objectively we don't discuss men's health as much as we discuss women's health, right? And obviously I don't want to, leave out any other communities. And I say that to say, this has impacted people financially, emotionally. I know people who are a part of the LGBTQ community who are moving because they can't get the care that they need in certain states. Do you have similar stories, or have you heard of patients who are impacted by this, whether they are uprooting themselves in their lives or they're emotionally worried and impacted?
We have, onslaughts on mental health, reproductive health in the case of women per se. And so it's really important to talk about this idea of the social determinants of health. So it's not just about biology and the body, but also these larger structural forces, things like poverty, racism, sexism, but even things like the structure of parenting in the U.S. and childcare and how all of these things play together. In my work, when I'm talking to large audiences on burnout, it's that universal perspective of really seeing how all of these play into the individual experience of stress, burnout, and mental health.
Doctor, as you were giving us your answers there, it got me thinking about just kind of where we are today in society. And I wanted to ask you in a moment what your message is to the people who are in medical school right now or about to go into college thinking of a pre-med. Because, Ashley, for example, being a journalist right now is pretty hard. There's a lot of people out there that just by having this profession, it's kind of vilified somehow. And so it must be a challenge for young people if thinking like, I thought I wanted to do this, but maybe I don't want to do this.
Yeah.
And doctor, it must be a similar sort of situation. Perhaps little boys and girls who always had the dream of becoming doctors are now seeing how hard it is and how they can be vilified. What's your message to them?
It's interesting, Eric, because initially I thought that this pandemic and the misinformation campaign that's been going on would deter people from applying to medical school or public health programs. And what we're seeing is that there are more young people than ever who want to go into this field because they realize first the value of medical education and public health education as a way to disseminate quality information to others. But also they are seeing for the first time because of the pandemic, the pandemic didn't have many silver linings, but one was that it really amplified the need for sound public health and good medical messaging. And this is something that I think many young people want to do. In my work in educating young people at the medical school and institution that I work in, we often talk about physicians being advocates of change. And so this is an opportunity for young people to really step into that role of advocacy, activism, to really pursue that ideal of universal health for all.
And I have to say, Dr. Aditi, I really appreciate you being an example because, similar to Eric's example of being a journalist, it's tough right now. And I got chills when you said that young people are not deterred by that because they really do understand how much we need them in your field, in ours, and in so many others. So thank you for being their example. Thank you for coming here and taking the time to speak with us about something that I'm sure we're all going to get messages about, but that doesn't mean you don't have the conversation. So thank you so much.
I feel inspired by that. Thank you, Doctor.